conference. Today, we will move through the program today. We have public health with us today, Phoebe Putney Memorial Hospital. Today, we'll hear from the mayor as well as the chairman today. I want to reiterate one thing before we start, and I want to reiterate the number. I've spoken with Dougherty County EMS, and they have been flooded with calls about whether or not they should be tested or not. And it is important to reiterate again the COVID hotline for Phoebe. This number is available, I believe, 8 to 5, Monday through Friday, 8 to 9, 9 to 5? Okay, 9 to 5 daily. Okay, 9 to 5, Monday through Friday. 229-312-1919 is the number you should call, and not call on our EMS resources. Okay, so I wanted to get that out. To begin us off today, I'd like to ask Mayor Beaudereau to come up for some comments to get us started today. Mr. Mayor.
Thank you, Chief. The key announcement I have this morning, this afternoon, is the Chairman and I will be enacting an emergency order tomorrow, but we want to go ahead and notify the community of basically what that order will entail. This is an emergency, and these precautions are being put in place for the protection, safety, health, and welfare of the entire community. If I could just go through these things briefly. The one thing is we are going to prohibit gatherings of more than 10 persons. This will essentially prohibit worship services. But I want to emphasize the order is going to be in place initially for only 7 days. We're going to look at it week by week. And things are rapidly evolving. We need to understand there might be directives coming from the state and federal government that are going to preempt what we're doing. But we're taking these measures to protect the community. The gatherings also include, we've had people go to city parks. Our parks are closed. We are going to, unfortunately, but this is necessary, we're going to have our police officers patrol police parks, city parks, and we're going to ask people who are there, whether they're playing basketball, tennis, whatever, to disperse. Restaurants will be closed for dine-in service. Now, those restaurants that have drive-through, we understand that many restaurants have already discontinued the in-dining, but restaurants that have drive-through will continue to operate, and they will also this ordinance will not prohibit delivery. So you have the options of takeout, drive-through. Importantly, we need to understand that we are basically suspending all entertainment venues. That includes bars, fitness gyms, bowling alleys, and it's under discussion. I don't know if a final decision has been made about the theater, but we'll talk and we'll have that in the ordinance. Another important issue is that we are having people who have been tested positive and have been released from the hospital. We also have people who are tested and under suspicion. Now, these individuals have been instructed to remain at home. We have some information, we don't know if it's credible or not, that some individuals who have tested positive or have been released under suspicion of having the virus are not following the instructions of medical advice. This will be a violation of the ordinance. It will be a misdemeanor. It will be a criminal offense. So I want to admonish anyone who has tested positive or anyone who has been released and is believed to have or has been tested and no definitive results, that person needs to stay at home It's not just a matter of following the advice of your physician, it is now a matter of complying with the law. I want to say we are cognizant of the impact this is going to have on local businesses, but we are taking these measures to protect the long-term interest of those businesses in addition to the safety of people in the community. There are some communities that have actually, in the state of Georgia, that have already implemented curfews. So there are measures that we have not adopted. I do want to say this about the restaurants. It's not an easy decision, but it's one that we've made on the advice of medical professionals, and we want to say that 4 states have already implemented statewide prohibitions against in-dining for the foreseeable future. But I want to reiterate, these measures have been adopted for only 7 days, and the task force will reconsider the impact and the effect of the measures we've implemented, as well as the expansion spread of the virus in that 7 days, and will continue to do so. Thank you for your attention. Thank you, Chief.
Mr. Mayor, if you'll stand by this moment, I'd like to bring the chairman up and make this joint resolution together. You'll come back up.
Say it one more time.
The joint resolution.
Oh, sure.
That will be done.
Well, I think the mayor already covered a lot of it. The mayor and I have been working very intensively on first of all taking the advice from Dr. Ruiz as well as from the CDC, and we've created some bullet points. Here are the bullet points on what we're going to have to do. And this is, understand this is not because we want to shut down businesses. It's not because we are anti-church. It's not because we're anti-restaurant. Both Mayor Dora and myself are both business owners here in this community. We live here, our families are here, but this is coming from best practices from not only from the CDC, but also from the health department. And as of right now, we have 331 people that are under suspicion of having the coronavirus. We have had as many as reported as 4 to 5 deaths that have already been associated with this disease outbreak. So this is a very serious matter. That being said, we have worked together to develop with our health department representative certain recommendations on a 7-day basis. That's first. There will be a 7-day shutdown for all gyms, bars, and recreational facilities. That includes theaters, bowling alleys, and things of that nature. There will be no public or private gatherings of more than 10 people at one time. All church gatherings are canceled. There will be, with the only exception, there being an exception for funerals of graveside services of no more than 10 people. And I say that, and I understand how hard that is, but we have seen already in this community how much this disease has been spread at gatherings at church and at funerals, and we cannot afford to be attacked anymore by that. There will be a 7-day restriction on dining in for restaurants. There will only be takeout, delivery, or drive-through and curbside. So in other words, there will be no dining inside of restaurants for 7 days. This comes on the recommendation from the CDC and the Public Health Department. It's just good practice when we have this many people in our community that have the virus and so many people that are at home. Additionally, there will be a 7-day restriction for grocery stores and retailers to only allow 25% occupancy into their stores with no more than 50 at a time. This is, again, based on the best practices and recommendations from the healthcare professionals that we are dealing with and that are working directly with us. Business owners are going to be required to monitor and enforce these mandates, or fines will be imposed. And I say that not to sound overly harsh, but we're dealing with life and death decisions here. The city and the county will continue to monitor the conditions of the coronavirus, and the mayor and I are meeting every single morning along with the task force, and we're not coming up with these recommendations lightly. These are based upon the learned advice of Dr. Ruiz and other members of the Public Health Department. And anything I left out there, Mayor?
No, I didn't. I'm glad you caught the grocery stores and retail. I forgot about that because that is very important.
Very, very much so. So those are the items that are going into effect. Will be in effect as of tomorrow. We will be finalizing that document and issuing that order here shortly. And again, understand, it is not because we are anti-church, it's not because we're anti-business, it is because we are pro-community, we are pro-safety, and we are trying to protect our community. And understand that many other communities around the United States have already had to implement these orders and more. That being said, I want to turn the page to a couple of other issues. Yesterday, I had a direct phone conference with the governor, made him very aware of our situation here in Daugherty County, and as I've stated before, we are, if not the #1 site for infection for the coronavirus in the state of Georgia, we're either #1 or we're #2. Our rate of infection has been very rapid, and the number of cases have continued to grow. We have to adopt all of the social distancing recommendations that we have already recommended. We have to really adhere to that. We have to live by that. But we also need significant resources because this disease spread very quickly with very little notice and without people having the opportunity to know. And it isn't because anyone did anything wrong. It's because we had a series of unfortunate circumstances where the disease proliferated very, very quickly in our community. That being said, I've spoken directly with the governor. I've requested tremendous assistance from the state. I've also spoken directly with the head of the Department of Public Health. I'm pleased to announce that based upon our request, we will be receiving an epidemiology investigative team from the Department of Public Health to assist us here in this community in investigating the linkages between carriers and infected persons, and for us to be able to develop a strategy to better mitigate and stop the overall spread of the disease. Secondarily, we've gotten a commitment from the Department of Public Health for us to actually have a state-run quarantine facility here in this community. And thirdly, and I'm very happy for this, Public Health will be establishing one of its 2 federally funded testing sites here in Albany, Georgia, that no other community except for one other that I am aware of will be receiving. And that is because we have been working very hard to make requests of the governor of the state, of federal government. We've asked for everything that we can in order for us to be able to best address our community's needs. That will, in turn, enhance our community's capability of getting test results in and done versus the 6 to 7 day wait that we're currently dealing with based upon the vendor that is providing services to Phoebe. And so that is a very good announcement for us at this time. We will continue to communicate. I spent a lot of time yesterday in person with Congressman Bishop, who is our congressman responsible for representing us in Congress, and he's very well aware of our needs. We have made recommendations that dollars be deployed here. We understand and know that businesses are already suffering, that people are suffering, and that this has had not only a health impact, but an economic impact, and it is hitting us particularly hard. And I thank you for your time and your consideration. Thank you very much.
Thank you, Mr. Mayor, Mr. Chairman. I'd like to ask now Dr. Charles Ruiz to come up and give us a report, public health standpoint. Dr. Ruiz.
Well, if anyone were to say that this COVID-19 situation is better, I would have to say that they're very much mistaken. On the other hand, if someone were to say that the COVID-19 situation is hopeless, I would also say they're very much mistaken. There are things that we can do, and we don't have a vaccine yet, and we don't have a cure just yet, but that does not mean that we're helpless and without any means to strike back at this virus. Right now, our main objective is to slow this virus down. It's going to move through the community, and we have some say-so about whether it runs through quickly and in a very dramatic way all of a sudden, or whether we slow it down and spread it out. And it would be in our best interest if we could slow it down and spread it out, because when it goes through quickly and when we have a very high percentage of the population involved, then we are at risk of overwhelming our healthcare system. And we don't want that to happen. So our objective is to slow the virus down. If we do that, we will reduce the chance of overwhelming the healthcare delivery system. It will also buy us time for herd immunity. If a virus goes through very quickly, we don't have that time. Immunity doesn't occur overnight. But if we can slow it down, there will be some individuals who will have mild disease or maybe no symptoms at all, and we will develop some immunity throughout the community, and that makes it harder for the virus to spread around from one place to another. Slowing the virus down also buys time for medical advancements. And we've all probably heard some talk on the news lately about some ideas that are going around the medical and scientific community. In time, we will likely have some more ammunition that we can use against this virus. Slowing the virus down also buys us time for the onset of warmer weather. While we cannot guarantee that warmer weather will help, many viruses simply don't prosper as much in warmer weather, and it may be true for COVID-19. We don't know that, but there's a possibility. So how do we slow it down? Our best chance of slowing down COVID-19 is with social distancing, and we cannot say that too much. And we've got to be united. If a portion of the community practices social distancing and then the other half does not, we really haven't accomplished much. We've got to come together as a community, as a team, in fact, as a nation, if we're going to be successful in accomplishing this goal. The news that Chairman Cohill spoke of regarding the public health assistance is sort of hot off the press. I don't have the details of that at this moment, but I can say when it comes to collecting specimens for the testing for COVID-19, we're going to expand that beyond the limits that I talked about just yesterday. The original plan for us here in Dougherty County was to limit our testing to people who were healthcare providers or first responders or employees or residents of long-term care facilities. We are going to definitely expand that, and we will be including people in the community who have pre-existing medical conditions. I don't have the details yet, but we will likely have a special telephone number that providers can call to get people pre-approved for this testing. We're hoping, we have reason to think that we may be able to test, we're not going to test, we're going to collect specimens that we will send for testing. We're hoping that we can process as many as 100 people per day here in Dougherty County. We're not able to say exactly when that will start, but as soon as possible, we will get that started. And also, I want to say that public health supports entirely everything that Chairman Cohill and the mayor and the chief have said today. It's very important that we stay away from each other if at all possible, and that includes gatherings at church, weddings, dining in public. All of those things we have to think about in a different way now. We all enjoy those kinds of get-togethers and pastimes, but it is just simply too big of a threat for us to do that. This is not permanent, it's temporary. At some point we're going to get through this, but until that day happens, we have got to work together and stick together. And I want to say again, because we can never say it enough, if you are sick, you need to stay home and call your doctor to get advice on what to do regarding a face-to-face evaluation and testing. You should avoid sickness unless you are a caregiver, and you should practice social distancing at all costs. Thank you.
Thank you, Dr. Ruiz. Dr. Stephen Kitchen is here. He is the Senior Vice President and Chief Medical Officer for Phoebe Putney Memorial Hospital for some comments. Dr. Kitchen.
Thank you. Thank you, Chief, and good afternoon. I think first and foremost, the message I would like to get out is, I think, going to be very similar to what you've heard from Chairman Cohilas and from Dr. Ruiz as well, and that simply I cannot overstate the importance of adhering to social distancing at this point. We're all looking at what are really the most effective measures that we can put into place to curb the incidence of coronavirus that we're seeing not only in our community, but statewide, nationwide, and worldwide as well. And what we know is that this virus thrives when human beings are in close contact, because person-to-person transmission is overwhelmingly the primary source of transmission that occurs. Yes, it will live on surfaces up to 9 days, and yes, we need to be absolutely vigilant in our cleaning and disinfection approaches. But again, there's no one single thing that we can do to impact the curve of this, and you've heard from many people about flattening the curve, and truly, I think that is within our midst. But it's going to take really, a different approach than we've done, what we've used before. And I think what we're all recognizing right now is that it's a different world that we live into right now, and I know. Anytime there's uncertainty, that can be unsettling. But again, there are some very effective modalities that we can put into place to curb the number of exposures and the number of cases of COVID-19 that we're seeing. So with that being said, I will provide an update in terms of what we're seeing at Phoebe Putney, as well as across our health system as well. To date, I will tell you there have been a total of 750 people who have been tested for COVID-19. 671 of those tests are still pending at this time. As Chairman Cohilas said, as Dr. Ruiz stated, we fully expect the number of cases both at Phoebe Putney as well as in our community and our state is going to continue to go up at this point. So yesterday we had a total of 23 positive cases. That number has increased to a total of 43 positive COVID-19 cases effective as of today. 19 of those patients remained in the hospital and 20 are at home. Unfortunately, we have seen the number of deaths go up. We had 2 deaths that were COVID-19 associated effective yesterday. That number has risen to 4. We unfortunately had a patient that expired late yesterday afternoon. The 4th death is actually someone in the community who experienced a cardiac arrest in the field, was transported via EMS to Phoebe Putney, was dead on arrival. They had been swabbed, and their test did return as positive. So a total of 4 deaths at this point, and certainly our thoughts, our prayers, and condolences go out to the families of those individuals. Again, we've talked a little bit about what our readiness and response has been, and that we have basically deployed a couple of our inpatient units at Phoebe Putney to basically cohort the COVID-19 patients who are either under investigation or who have positive test, and that is still a process that is ongoing at this point, and I will tell you, I think is running as smoothly as anything like that could at this point in time. The morale of our staff continues to be exceedingly high, and I think they really draw upon each other at this point, and as we've stated many times, oftentimes The real character of an individual or an organization is not revealed until we're really confronted with adversity, and we're seeing that we're seeing that spirit embodied every day at Phoebe Putney. Our intensive care units continue to be very busy at this point. Basically, we have a total of 38 ICU beds, and basically about 24 of those beds right now are being utilized by patients who are either suspected or confirmed with COVID-19. And I will tell you, I think the reassuring news is, like I say, we've had a total of 750 people tested at this point, 671 tests that are pending. Over 600 of those individuals are at home. So again, whether they test positive or test negative, what I will tell you is most people seem to be experiencing relatively mild symptoms at this point. For those individuals who do require hospitalization and who do become seriously ill, what we know is about 25% of those people will require ICU care. And if their illness is severe enough that they are requiring what we call mechanical ventilatory support, unfortunately, the mortality rate is significantly higher in that group of individuals than it is in the population at large. So that's the update that I have for Phoebe Putney today. So thanks so much.
Barbara Rivera Holmes is here to give us a business update. She is the president and CEO of the Albany Area Chamber of Commerce. Ms. Rivera.
Our public officials have an arduous task in balancing the public health of our community with the economic stability of our community as well. And the decisions that are being made, the orders that are being put in place, absolutely have an impact on our business community. I am so encouraged, however, by the outpouring of support that I have seen from our community partners in support of our small businesses. There are so many ways to continue to support our small businesses through shopping online, curbside, through pickup, through buy now, pick up later, by saying thank you, by following them online, by showing up as appropriate to show that support. It is equally important that as we go through this process to stop the spread of the virus, to mitigate the impact on people and the workforce and our businesses, that we follow the guidelines of the CDC and the orders that have been put in place to support our public health and to support our businesses. If we can stem and flatten this curve, our businesses can continue to operate in the way that they're used to, and the quicker that we can get to an economic recovery period. I'm advising, to the extent that is appropriate, our public officials on the status of our business community, on the impact that this virus has taken on commerce flowing through our area, and on ways that we can continue to support our businesses in light of the viral infection that is rampant. So I want to say thank you to our public officials for heeding the interests of the business community through this time, while again managing the public health component. Again, I'm highly encouraged by what we're seeing in regards to the community support of our small businesses. It is so important. Our community thrives off the backs of these small businesses that give so much to us, that employ so many people, and that contribute daily to the vitality of this area. I encourage all of our businesses that are making the modifications to continue to do so within light of the orders. Continue commerce, encourage your consumers to utilize your products or services or engage in a new way. And many of our businesses were proactive in making modifications even before the orders, so that they would protect the public, would protect their workforce, and that so commerce and business would continue. Does business as usual? No. But business continues in a different way. Thank you to all of our public partners, our medical professionals, our public health officials, and again, our community for the incredible support being shown to our public in light of health and to our businesses through this time. The Albany Area Chamber continues to be an advocate and a resource for all of our businesses throughout Albany and the Albany area. We are launching a new campaign specifically targeted at business growth, business development in support of our small business community. Follow us on Facebook, look for us on albanyga.com, and continue the incredible work and support and uplifting of our community through this time.
Thank you very much. We're at the point now that we can begin to take questions from those who you've heard from today. So we will begin to do that. They will make their way to the mic as questions come in.
Let me ask a question here. Something came in about gas pumps. Can you speak to that effect of people pumping gas? Is there any we're transmitted, or should they have gloves or what have you? I've got that question in the text here, so I just want to see if somebody can clarify that, shed some light on it.
Dr. Kitchen is making his way this way.
I will take a stab at that one. I certainly understand the concern. There's no question that, like I said, the virus is known to live on surfaces. I do think this is a perfect example where practicing hand hygiene and having hand sanitizer in your car can go a long, long way in terms of reducing the chances of transmission via any type of a surface. So I keep a little bottle in my car, and I do make it a practice to use it every time after I pump gas. I mean, you could certainly use gloves if you prefer to, but I think you can largely mitigate the risk simply by using hand sanitizer.
I have a question. Is there anything specific in the executive order about the grocery store mandates? Some more details on those? I know people are gonna run to the stores.
Sure, it's going to be, it's a 7-day restriction, and we're trying to get, we're trying to get ahead of things, and we're trying to flatten the curve. This is a 7-day restriction for grocery stores and all retailers to only allow 25% occupancy with no more than 50 people in the store at a given time. That is designed to allow people to still be able to shop, for the businesses to be able to stay open, to be able to service the needs of the community so that folks can get eggs and milk and bread and things like that, but we don't need more than 50 people in the store at a time. And this is a 7-day restriction. Also, I meant to also make it very clear, the 7-day shutdown for gyms, bars, and recreational facilities. That's all gyms. It's not just like the YMCA or gyms like that. I mean, it's your yoga facilities. It's every gym that's there, and that's based on the recommendations from the health department, because you have people that are sweating, breathing, expressing a lot of body fluids in those areas, and this is a contagious disease, and so we need to arrest that type of activity at least for the next 7 days.
Does anything apply to convenience stores, dollar stores that aren't technically grocery stores?
No. I don't think convenience stores qualify as grocery stores. I think that obviously they're going to be required not to allow any more than 50 people in their store as well. I don't think that typically happens, but obviously they're going to follow.
They're smaller and they're very busy.
Sure, absolutely, but they're still going to. There are other components like the provisions that say you can't have more than 50 people or 25% occupancy. It still is a retail store, so if your occupancy level is 50 for a convenience store, take 25% of that. That's the maximum that you can have in your store at any given time. And what we're going to ask is we're going to have these posted on a lot of these businesses, and we're going to expect that business owners are going to self-police. Otherwise, they're going to be fined because we need everyone's cooperation. And let me also say this. We have a lot of business owners that are already taking these steps. A lot of businesses that have already voluntarily shut down all in-room dining services. And frankly, I've spoken to a lot of restaurants, a lot of local restaurant owners that actually want this to be in place so that it provides them with direction. And what you have is currently you have some businesses that they're taking advantage of the lack of competition, and they're operating and allowing massive numbers of people to come in at great risk to the public, and we need to eliminate that risk at this time.
So for the misdemeanor, like that y'all put into place for people who are supposed to be like quarantined? Or
Yes.
How is that going to be implemented? Like how does that work? Like how will you know?
If you don't follow it, then you're going to go to jail.
But are people like, are they supposed to find them? Like how are they going to identify these people?
I'm sorry, who's they?
So if there's 300 people that are supposed to be like self-quarantined, how will people know? Like how will officials know?
Look, honestly, we're counting on the good faith of the public in many ways. And so, look, if you know that you're suspected to have the virus, just do the right thing and don't go out in public. Don't go out into restaurants. Stay at home. If you need a facility to quarantine yourself in and you don't have access to one, call the EMA and see if we can arrange for you to find some place to do that. Ideally, like, this isn't about trying to go put a bunch of people in jail. This is about trying to keep people safe. And so us attaching a misdemeanor on it is frankly a way of punctuating the sentence and really letting people know that this is important. So yes, now we're not going to go and raid the rolls of all of these different healthcare professionals to find out people's names, but if you do know someone that is that absolutely has been tested for the coronavirus and is under the suspicion of having the coronavirus, and they're out gallivanting out around and putting people in danger, then you need to call the emergency management agency and let us know, because not only do we want to deal with that locally, we also need to let the public health department know and the investigators that we have that will be coming down from there.
What does treatment consist of if they are like in the hospital or waiting for results? What does the treatment consist of until the results do come?
We had a question regarding what is the current recommended treatment for COVID-19 for coronavirus. You know, coronavirus, like virtually all viral infections, does not have a specific treatment. It's not like bacterial infections that tend to be susceptible to antibiotics. So currently the treatment of coronavirus, COVID-19, is what we call supportive care. Now, what does supportive care mean? It means that we treat all the symptoms. You know, if someone has a fever, we treat that. If they are dehydrated due to loss of fluids, that sort of thing, they're certainly treated with either oral or intravenous fluids if the need be. If they're experiencing any sort of respiratory difficulty, shortness of breath, there's a number of modalities that we can use to treat that. And in extreme cases where they become severely ill and require admission to an intensive care unit, then, you know, all the treatment modalities we have at our disposal for patients in an ICU, you know, and that goes all the way to usually what we call mechanical ventilation, where we put them on a ventilator. All of those treatments are in place. I will tell you there are some investigational treatments that are being looked at right now, and actually our critical care physicians are intimately involved with that. So there's a couple of treatments that can be utilized on an investigational basis. There are certain requirements that those patients have to meet. We make sure they fully comply with those. But I want to emphasize these are not proven treatment modalities. They are investigational. So if it's someone who is severely ill, is in one of our intensive care units, and their condition is such that we really feel like it's a life or death matter, then we will use one of those investigational drugs at that point.
So has anyone recovered from critical care at this point?
Yes, they have. We have several patients who were hospitalized, who were transferred into one of our intensive care units. Their condition did improve, and so they were transferred from one of our critical care units to one of our general medical units. And a few of those patients have actually been discharged from the hospital and have gone home.
I read a comment the other day that you're still seeing like an influx of people with just a regular flu. Is that taking away from any resources that you need to treat patients with COVID-19?
You know, I will say, I think we recognize we are in unprecedented times and unprecedented waters at this point. So there is no question, with the influx that we have seen, obviously hospital sources or hospital resources are going to get taxed to some extent. We feel like we have made very deliberate and intentional provisions for that. And so regardless of whether it's patients who are coming into our facility with flu or any one of a number of illnesses, we feel like we have not only the beds, not only the resources, but most importantly, the staff, the nurses, and the physicians that's required, whether someone is coming in because of the flu, whether they're coming in with a heart condition or some other type of infection or any one of a number of things. So I will tell you, at this point, all of the services that we provide are still up and active at this point.
How many hospital employees or health system employees are at home now for potential exposure and if any of them tested positive?
Yes, let me see. I've got that number right here. We have a total of 86 employees, and that's across our health system. So that's not only Phoebe Putney. Yeah, so that's Phoebe Putney here in Albany, Phoebe Worth in Americus, Phoebe Sumter in Americus, and Phoebe Worth in Sylvester, as well as our outpatient clinics. We've had a total of 86 employees who have been tested. We have 6 employees who have tested positive. 5 of those are at home and 1 remains in the hospital at this point.
Dr. Kitchen, could you emphasize a little bit more on family members that have been tested positive and have family members that's home with them? They've been around the person, people that was at that funeral. I'm not on the ran off the look. Some of the people that was at the funeral, people that's tested positive, and some that have passed, and some still in the unit. They asked me the question, if I was around them, I was hugging them during that time, what do I need to do? And also the one that lived in the house with them that had a husband or wife, had kids and all, what they need to do.
Sure, and that's a great question, and let me respond to that. And again, I will tell you, we try to make sure we're in complete accordance with the guidelines from the CDC as well as the Department of Community Health in terms of exposures. And so the CDC, I think, has a very logical way to try to categorize those exposures, and they basically categorize them into what are regarded as high-risk exposures, medium-risk exposures, and low-risk exposures. And we apply those same guidelines to our hospital staff as well. So the way I would counsel or advise those individuals is if they think they have had, close contact, particularly if it's been for, any significant amount of time, yes, that certainly poses an exposure risk. And the way I would advise them, if you think that's the case, I would advise that they self-quarantine at home, avoid close contact with other family members, stay at least 6 feet apart, make sure you're not sharing utensils and that sort of thing. Ideally, they should probably sleep in a different bedroom, that sort of thing. And if they should start developing the typical symptoms, cough, fever, shortness of breath, then I would recommend they contact their physician, seek medical attention, and it would be perfectly appropriate to test them for COVID-19 at that point.
Dr. Lewis?
Dr. Lewis had to step out. Yes, had to step
Is
out.
he gone for good?
I think he's already gone. I think he's already left.
Let me ask the chairman a question here. Chairman, the mayor says all the city parks are closed, what about the county? And I'm incorporated there.
I think what we're working through is some language on, as opposed to necessarily just shutting down the parks, but utilizing the language about no public gatherings of more than 10 people. I think that deals with the issue. And I think he and I are still working through some language on that, because we want to be on the same page, both together. So I think we're working on that. I think that if we completely shut down access to all public spaces, that may be difficult, but we're working through all that.
Okay.
Working through that, we're gonna have a joint recommendation, or joint order. Okay?
Chairman, would you also clarify about production paints and distribution centers and what the
Sure,
order looks like?
manufacturing will go on as long as they're following the
6-foot rule.
6-foot rule.
So manufacturing, production, distribution goes on 6-foot
Absolutely.
distancing. Got
It's
it.
not gonna affect Miller Coors, bars, or any of our big industrial partners.
Thank you.
Okay, well, we're going to conclude for today, and we will be back tomorrow at 1 p.m. For press conference tomorrow. Thank you and have a great day.